How is MGUS monitored, and should I see a specialist or seek treatment?
It's a very important point. The moment we know that the patient has MGUS, we know that we want to follow them very carefully. So it could be even once a year. Come and see us, we'll talk about life, we'll talk about everything else. But we check the monoclonal protein, we check the light chains, and we potentially may look at other things, whether we need to do imaging of the bone, whether we need to do bone marrow biopsies in the future. But just a close observation is very important.
Should MGUS patients get genetic testing?
We are doing now on research level next generation sequencing to look at a very deep level who are the patients who may progress in their lifetime. Not all MGUSs are the same. There's MGUS that will never progress to myeloma, and that's great. They can enjoy life. And there's MGUS that may actually progress. And we know that every single patient with myeloma must have had an MGUS in their lifetime or a smoldering myeloma in their lifetime. So let's detect it then and figure it out before they develop the myeloma in their future.
Should a patient with MGUS see a myeloma specialist?
I think in general, I would like to see at least one time a doctor who knows multiple myeloma, especially MGUS. It's such a rare disease. And if your doctor sees breast and lung and other cancers, they will look at MGUS and say, you don't have anything, you're fine, go see your primary care doctor. Well, we care. I care to see MGUS. I want to see that patient, and I want to make sure I follow that patient carefully so that we don't miss myeloma. So I would say, see someone who cares to know that they don't miss myeloma.
Should MGUS be treated?
We don't think that MGUS should be treated. However, it's an interesting question. Could we potentially prevent myeloma from happening by very early interception at the MGUS stage that will really develop myeloma? So I have a lot of points here. Not all MGUSs should be treated, but there is a subgroup of MGUSs that may actually develop myeloma in the next 10 years. Should we develop a vaccine therapy? Should we think of some early interesting intervention, something that you can really get rid of the disease at an early time point? And this is where we're thinking of vaccine therapies, really interesting ideas of how to truly prevent the disease from progressing.
Dr. Irene Gabriel is running a large study for MGUS and smoldering myeloma patients called the P-Crowd study. It is an observational study where you can send in blood and bone marrow samples that are drawn at your existing facility and mailed to her. You can join that study at pcrowd.danafarber.org. To track your M protein over time and to help accelerate research for the prevention and cure of myeloma, join HealthTree today at healthtree.org.